Hi, Cindy. My name is Nick Randall. I'm with Laser Vascular Center. Can you tell us a little bit about yourself?
I'm a nurse practitioner here in the office, so I see patients in the clinic and basically get them through the day, and then if they need procedure, I schedule there for our doctor to perform. So
What kind of services do you do?
we treat a lot of peripheral arterial,
Preferred arterial?
peripheral
Gotcha.
peripheral artery disease. So the large population are diabetic patients with ulcers or slow healing wounds to the feet and toes. And then we also have a lot of venous insufficiency patients. So those are usually younger populations with painful swelling legs, bulging varicose veins that needs treatment. So that I see those patients in clinic also and set them up for procedure for our vascular surgeon to treat them with minimally invasive procedures.
From a layman's standpoint, what's the impact for the patients? Like, where do they start with and where do they end? What is it? I don't know a lot about this kind of thing.
Okay, so for the PAD patients,
PAD means
PAD, peripheral arterial disease patients.
Gotcha.
So those are patients with painful muscles or slow healing wounds. They would have a much speeding time on healing, and so avoiding or reducing the risk of infection in the wounds, and hopefully we can salvage that without having them going through in the very dire future predicament of amputation to the legs. Muscle pain patients, if they have better circulation, they can walk better, they would have a more independent lifestyle, healthier lifestyle that way. For the vein patients, generally reduction of swelling and pain, so they can also have a better quality of life.
Okay, excellent. What's the actual procedure? What do they do?
So the procedure we have for the arteries, we have the angiograms. So that's layman's term is Roto-Rooter. Our Dr. Brennan is the primary interventional radiologist who does those procedures. They basically blast away the plaque, the block the blood flow outward to the toes and the muscle on the legs. So that's angiogram, angioplasty, balloon, stenting sometimes are involved in cleaning out the arteries. Vein procedures, that will be occluding the veins that are problematic and causing a lot of swelling and building of the tortuous varicose veins. So those are the vein procedures. It's called venous ablations, either by laser or Varithena, a chemical injection to close down the veins.
Okay. Now I understand you're looking for someone to join your team. What's the title of that position? What are you looking for?
I am looking for, it could be somebody who has background in medication administration in a nursing home, or a caregiver who has a medication administration experience. But it's maybe a role of a medical assistant role, basically help me prepare the patient in rooming the patient before I see the patient. So they have to know how to load the charts, build a little bit of chart from typing, entering patient's medication list, and then when the patients are actually here is, get the patient into a gown, preparing for ultrasound, and also just a quick history and physical on the patients, what kind of medication you're taking, and what are we doing here today. So preparing the patient in the room so that when I go in the patient's room, they're ready for me.
Okay. Is there any front office work with this, or is
Yes,
yes?
yeah.
Tell me more about that.
So front office work, between the rooming patients or after the patients clear out, if the phone call's coming through, we'll train the staff, of course, on these, that might require some training in this kind of specialty.
Mm-hmm.
So if a patient calls in, hey, I would like an appointment, or I have an appointment that I need to reschedule, or I have an issue with leg pain, various clinical questions, the staff should be able to answer those questions, or, know when to ask help so that I could be there of support. And help the patient that way. So multitasking is important. If a patient is coming through the front door and the front office that is busy on the phone, then we would all need to jump in and help checking patients in. So those are the more administrative front office work, in addition to helping the patients, ready for me for clinic visits.
Good. What's the pay range for this position?
I'm not familiar, actually. We'll have to kind of refer them to HR.
15 to 20, is that what we're talking about?
15 to 20. 15 is low.
Is
15
it?
alternate rate, yes.
What would you call it?
I would probably say, 17 to 20. Somebody who is very good, a lot of experience, minimal training.
Gotcha.
20 would be great to incentivize them. But
Yeah.
20 is rare on the higher end of the spectrum.
If you hired someone towards the higher end, is